Welcome back to the Socialist Report. We got another video for you right here. This is also from the World Socialist website. Canada passes 50,000 registered COVID-19 deaths as triple-demic wreaks havoc on healthcare systems nationwide. Now, this is the first time for me hearing anything about COVID-19 from a socialist perspective, because most of what I've heard about COVID-19 has been from liberal perspective or social democrat perspective. So let's see what they say. Fatalities from the COVID-19 pandemic passed a grim milestone in Canada over the weekend as the official death toll surpassed 50,000, according to data tracked and collected by Dr. Tara Moretti, an associate professor at the University of Toronto Medicine. At least 50,000 Canadians have died from COVID-19 as of December the 18th, although she estimated the real figure to be closer to 80,000. And for people like the COVID deniers or whatever, I don't really go into that terminology that much because I believe there are reasons to be skeptical of COVID-19 and skeptical of Big Pharma and all this around COVID-19, but I'm not going to say too much about that yet. But to all those people that don't actually believe in the virus, the reason that they think it would be more is because of the testing. Not everybody gets tested, and they're just not some people that do have the virus don't get tested, and therefore it doesn't get reported, and sometimes they mess up the numbers. So meanwhile, hospitals across Canada are experiencing extreme pressure over what many officials are referring to as a triple-demic of respiratory viral illnesses, specifically high levels of influenza, RSV, respiratory syncytial virus, and COVID-19. Pediatric hospital admissions have exploded nationally, with growing levels of infections also among seniors. The situation has caused many hospitals to put into place operational emergency protocols to deal with the massive surge of patients. The BC Children's Hospital in Vancouver, the largest pediatric care institution in the province, become one of the first to declare a code orange, activating its emergency triage procedures. On December 23rd, an internal memo obtained by the Canadian press indicated that the hospital had implemented double bunking, putting multiple children in single rooms. In Alberta, health services were diverted from other services, including respite care, to help deal with the flood of pediatric patients. In Calgary, officials were forced to open heated trailers outside the main children's hospital to deal with the overflow of patients. The United Nurses of Alberta trade union issued a demand Wednesday for an indoor mask mandate to slow down viral transmission. In Montreal, the largest city in the province of Quebec, the city's two pediatric hospitals report an average occupancy rate of 112%. Two children have recently died in the city from strep A infections. The chief of emergency medicine at St. Justin's Children's Hospital, Dr. Antonio D'Angelo, stated that the inflow of patients was something he had never seen before, and added that it is scary to think how the next few weeks will play out. Meanwhile, medical authorities have announced an investigation into the death of a 2-year-old infant in Ajax, Ontario, which prompted widespread outrage on social media, directed at hard-right Premier Doug Ford for his spending cuts to health care. A video posted by a woman claiming to be a nurse who witnessed the death, indicated that the young child may have died on the floor of an ER room because of overcrowding. Data provided to Global News showed a 150% increase in pediatric hospital admissions in the province over pre-pandemic levels, a trend that has been on a steady increase since July. The Children's Hospital of Eastern Ontario formally requested volunteer help from the Canadian Red Cross, a step from underscores that the province's healthcare system is collapsing. Okay, to take a break from that for a second, I want to point out that the problems with Canadian hospitals is they're terribly underfunded because right-wingers get in there trying to cut healthcare funding. So that, and if you think United States hospitals are much better, yeah, they have better healthcare, but the thing is, people are price gouged into the ground, and were overcrowded during COVID-19 pandemic as well. They didn't even have enough ICU beds, or they didn't have much of anything in order to hold patients during the worst parts of the COVID-19 pandemic. Data provided to Global News showed a 150% increase in pediatric hospital admissions in the province over the pre-pandemic levels, a trend that has been on steady. Oh, yeah, I already read that. A poll released by the Ontario Federation of Labour earlier this week found that 79% of respondents think healthcare is in a state of crisis and 55% blame the situation on Ford. There is no doubt that Ford's progressive, conservative government's savage austerity measures since coming to power in 2018 and the imposition of brutal wage restraint through Bill 124 on public sector workers has slashed hospital budgets and driven workers out of the industry. But the crisis in Ontario and across the country is the result of decades of ruthless budget cutting backed by all the established political parties since the 1990s to fund tax breaks for the corporate elite and Canadian military interventions abroad. Like I said, from what I understand about Canadian politics, most of the political parties in Canada, at least the most popular parties, are just right-wing corporate capitalist parties that are against public health care because it is more profitable to have healthcare privatized. The Trudeau government has maintained a strict 3% cap on health transfers to the provinces since coming to power in 2015, helping ensure that health spending has consistently fallen in real terms. Yeah, Justin Trudeau, he is not helping the healthcare situation because he's nothing but a liberal capitalist, and they need a left-winger in there. Trudeau is on the right, just as far right as Joe Biden here in the United States is. The Atlantic provinces also confront a healthcare crisis. In New Brunswick, where at least 5 patients have died in emergency rooms over the past 6 months while waiting for care, public health authorities revealed that cases of RSV among children were 800% higher in November than in previous years. Dr. Andrew Link, the top doctor at Halifax IWK Health Center, the largest children's hospital in the Maritimes, told Global News on December the 10th that the hospital is continuing to get slammed with patients. As RSV and flu infections rage on, Canada appears poised to enter another deadly winter COVID wave. On December 14th, Chief Public Health Officer Theresa Tam told reporters that the country could experience an uptick in the next year, despite desperate attempts by Tam and other public health officials to downplay the dangerousness of the virus. Emerging data shows that the country may have already been seeded by BQ variants of Omicron and is in initial stages of a winter wave just before the winter holidays, when increased travel to visit family and friends will facilitate viral transmission. In BC, data released by the BC Centre for Disease Control on December 16th showed a marked increase in infections, hospitalizations, and deaths from reporting the previous week. In Quebec, the province announced on December 20th that it was experiencing its highest levels for hospitalizations for COVID-19 since the middle of last summer. The callous disregard for the health and safety of children by the ruling class and their indifference to mass disease and illness has been brought into sharp focus this winter. The current healthcare catastrophe and the direct product of the decision by all provincial governments overseen by the federal Liberal government to adopt a program of the far-right Freedom Convoy last spring by abolishing all remaining restrictions on COVID spread. Overseen to adopt the program. Okay, yep, this is where I shift away from agreeing with this article right here, because the Freedom Convoy, I don't know. I don't want to say so, because I don't know for sure, but I don't think vaccine mandates are the vaccines do not prevent the spread of COVID-19, and the left cannot say that it does. If the left says that it does, it's not true. So the ruling elite's embrace of forever COVID-19, from the conservatives on the right to the New Democrats on the quote-unquote left, has been accompanied by pseudoscientific nonsense about the inevitability of the current wave of infections due to immunity debt. The logic of this argument, much like the bogus claim that herd immunity would offer a way out of the pandemic, is that we must accept permanent mass infection with whatever viruses are in circulation. Serious scientists have instead pointed out that the unchecked spread of COVID has weakened our immune systems and undermined the ability of already outstretched hospitals to provide care. And I would have a counter argument to that. The scientists that say this stuff work for Big Pharma. They are in bed with Big Pharma in order to get people to take the shot so that Big Pharma can make their profit from the vaccine. And people would trust the vaccine more if it was actually free and Big Pharma wasn't making billions of dollars off of this vaccine, and they didn't patent it, and every country would be able to get it, including the poor countries, especially the poor countries that cannot get the vaccine. So one of the prime examples of the moral bankruptcy of Canada's public health system is BC's Chief Public Health Officer Bonnie Henry and the BC NDP government she serves. On December the 3rd, Henry and BC Minister of Health Adrian Dix updated the province on the state of the pandemic. Days later, reports began surfacing in the media that 6 children in the province had died from influenza over the previous 2 weeks. Critical public health information that Dix and Henry deliberately withheld. Amid the public outcry, Henry and the DC promptly changed course and declared their intention to begin issuing weekly influenza updates. Henry, long a proponent of the far-right Great Barrington Declaration, a virulent anti-masker and denier of the fact that COVID spreads through the air in tiny particles called aerosols, is a kind of poster child for the pseudoscientific claptrap the ruling class has used to promote its homicidal live with the virus strategy. Alright, so I can agree with that sentence to an extent. I believe masks do work, and I think there should be mask mandates, probably still should be mask mandates. I believe that COVID does spread through the air in tiny particles called aerosols. And the ruling class has promoted the live with the virus strategy. But lockdowns and vaccine mandates are not going to prevent COVID from spreading. They have not worked, and they will not work. So, her concealment of the children's deaths demonstrates the depths that governments have succumbed in attempting to justify their murderous policies. So, I still think World Socialist website's a good source, but I cannot agree with them on this because the lies around the vaccine from the scientists, from Big Pharma, from Bill Gates, from Pfizer, Moderna, Johnson & Johnson. They are all centered around making money, making profits. It was publicly funded by the government of the United States, but then it was put in the hands of private corporations. So the vaccine is not as trustworthy as they say it is. I'm not saying to not get the vaccine. I'm not saying the vaccine does not work, but it does not prevent the spread of COVID-19. And it does not make you immune from COVID-19. It just lowers the chance of you dying from COVID-19. So that's my opinion, and I'm going to leave it there. Thank you for watching. Make sure you subscribe to the channel. That was from the World Socialist website. And that concludes this video. See you in the next one. Peace. This has been the Socialist Report.